Hello, how are you all? Hope you all are fine and preparing well for AMC Part 1 examination. This is Dr. Zahra and we are solving some Gynae tricky MCQs question. So this question has taken from AMC Handbook of Multiple Choice Question and this is MCQ number 3.305 and section 3 maternal health. So let's start discussion. A 21-year-old nulliparous woman present with a lower abdominal pain at 15 weeks of gestation. Her temperature is 37.8 degrees centigrade. She is otherwise well and eating normally. At the time of her previous antenatal visit at 11 weeks of gestation, her uterus had been found to be retroverted but of the expected size. Which one of the following is the most likely diagnosis? A. Impaction of the retroverted gravid uterus. B. Urinary tract infection. C. Complication of a corpus luteum cyst. D. Tubal ectopic pregnancy. E. Acute appendicitis. First of all, the two most incorrect option here is tubal ectopic pregnancy and complication of the corpus luteum cyst. So tubal ectopic pregnancy, if it is there, it's usually presenting in an early pregnancy, and because if some pregnancy, if it is present in the tube, so it should be ruptured, and they are presenting very early in the pregnancy with the complication of abdominal pain, shoulder tip pain, hypotension. If it is get ruptured, patient can be faint. So these are the some symptoms of the ectopic pregnancy, but usually it is presenting in an early pregnancy, like 4, 5, 6 weeks are the common weeks of the tubal ectopic pregnancy symptoms presentation. So this is, yes, lower abdominal pain is favoring the ectopic pregnancy, but this is 15 weeks of pregnancy. So 15 weeks of pregnancy is very rare that ectopic pregnancy can present in this 15 weeks of pregnancy, unless if it is abdominal pregnancy. So in the abdominal pregnancy, if abdominal ectopic pregnancy is there, so there are the chances that it can go beyond first trimester. It can present in 15, 16 or 20 weeks, but this abdominal ectopic pregnancy is very rare. It's very rare. And they have mentioned in the option tubal ectopic pregnancy. So tubal ectopic pregnancy cannot survive up till 15 weeks. It usually ruptured because tube size is very small, and it usually ruptured early in the pregnancy. So this is incorrect option here. And complication of a corpus luteum cyst is also the complication of early pregnancy. So this is 15 weeks pregnancy. This is coming in the second trimester. So 12 weeks beyond from 13 weeks we are counting as a second trimester. So this is second trimester, 15 weeks. So this is a complication of corpus luteum cyst is also a presentation of a early weeks of the pregnancy, and first trimester complication, and tubal ectopic pregnancy is also a first trimester complication. Now impaction of a retroverted gravid uterus, yes, it can present with a lower abdominal pain, and the second most common presentation with the impaction of the retroverted gravid uterus is urinary retention. So patient will be unable to pass urine, but this is mostly present when the pregnancy size is growing. So in the late half of the pregnancy, with the impaction of the retroverted gravid uterus, patient present with a urinary retention. So yes, lower abdominal pain is favoring, but what about the temperature? Why the patient is having the temperature? So whenever the patient is having a temperature, we always think about the always think about the infection. So there are the two B and E are actually the options with the infection. So acute appendicitis is also wrong because because the patient present with the iliac fossa pain, right iliac fossa pain, okay. And second, it is rare in the pregnancy. Yes, it can happen also in the pregnancy, acute appendicitis, but most common presentation in the pregnancy with lower abdominal pain and temperature. So the first differential always is UTI because it is most common with a fever and lower abdominal pain, most common diagnosis. So here is urinary tract infection is the correct option. Option B is the correct here. I hope this video clear your concept, and thank you very much.